Good morning, one. I am Sajida, Assistant Professor working from Emmanuel College of Nursing. Today we are discuss about the class second year BSc Nursing third semester Adult Health Nursing 1 Unit 4 Respiratory System. The topic asthma. Definition of the asthma. Asthma is a chronic inflammatory disorder of the airways. The chronic inflammation causes an increase in the airway hyperresponsiveness that leads to recurrent episodes of wheezing, breathlessness, chest tightness, and cough, particularly at night or early in morning. This is the definition of asthma. This is normal airway and during asthma symptomatic bronchioles. During the asthma symptomatic bronchioles, narrowed airway limited the airflow. The muscles also tightened muscles constrict the airway. It is inflamed, thicken the air wall, and mucus also they have to presented into the airway. Normal lungs, the muscles are relaxed, but the asthmatic lung, the muscles also they have to tighten, and the muscle walls also they have to swell and the lining. Excess mucus productions also they have to present from the bronchioles. Then incident. Asthma affect them and estimated 2,05,000 Indians every year, and this number is likely to increase by 50% by the year of 2016. Among adult women have 30% greater prevalence of asthma than men. Asthma triggers. These triggering factors: dust, fungus spore, cold air, chemical fumes, bugs in the home, pollen, exercise, pet, stress, anger, pollution, strong odors, smoke. This is also the triggering factors of the asthma. Next, triggering factors: allergen inhalation, animal, house dust, cockroaches, pollen, air pollutions, exhaust fumes, perfumes, oxidants, and cigarette smoking. Stress, viral upper respiratory infection, sinusitis, exercise, and cold, dry air. Stress, drugs during asthma trigger, aspirin, NSAID drugs, then beta adrenergic blockers. Occupational exposure like metal salts, wood and vegetables, dust, industrial chemicals and plastics, food additives, gastroesophageal reflux disease. Types of asthma. First, first type, allergic asthma. It is otherwise called extrinsic asthma. When the symptoms are induced by the hyperimmune response to the inhalation of specific allergen. Type 1, in immediate hypersensitivity reaction is the basis of the immunoglobulin E. Second, non-allergic asthmatic, it is called intrinsic asthma. Non-allergic asthma is called intrinsic asthma. Allergic asthma is the extrinsic asthma. Then this is the type of asthma is triggered by the presence of irritants in the air that are not related to allergies. These irritants stimulate parasympathetic nerve fibers in the airway, causing bronchoconstrictions and inflammation. Next, mixed asthma. Mixed asthma is the combination of both allergy and non-allergic asthma. This is the most common form of the asthma. The most common form of the asthma is mixed asthma. Next, cough variant asthma. This does not have the classic symptoms of asthma, such as wheezing and shortness of breath. Instead, it is characterized by one symptom, a persistent dry cough is present. This type of asthma, the cough variant asthma, they have the persistent dry cough is present. Then next is the exercise induced asthma, affect the persons during or after physical activity. Exercise induced asthma affects the person during or after physical activity. Next, nocturnal asthma, characterized by the symptoms that get worsen at night. Nocturnal means night time, the symptoms that gets worsen at night. Those who suffer from nocturnal asthma can also experience symptoms any time of day. Next, occupational asthma, induced by triggers that exist in person's workplace, induced tactiles forming and woodworking. This is occupational related conditions. They have to produce the asthma, occupational asthma. Mostly they have to work from the textiles forming and woodworking. They have to cause occupational asthma. Next, we have discussed about the clinical manifestations of the asthma. The main symptom, first one, wheezing, dyspnea, cough, chest tightness, expiration may be prolonged, secretion may be white, thick, tonics, gelatinous mucus also they have to presented. Then, diagnostic studies. First of all, they have to collect the history of the patients and do the physical exams. They have to helpful for diagnose the which type of asthma. Then pulmonary function test, peak expiratory flow rate, X-ray chest, ABG or pulse oximetry. ABG, arterial blood gas analysis they have to do. Then continuous oximetry means they have to do for this measure the monitoring for the saturation of the patients. Then allergy skin testing, blood level of eosinophils and immunoglobulin E. Next, complications of the asthma, rib fracture, pneumothorax, atelectasis, pneumonia and status asthmaticus. Management of the asthma. First, they have to given for the adrenergic beta-2 agonist. Second, steroids. Third, theophylline, hydration, M for mask, O2. They have to given to the oxygen. Then finally, A represent anticholinergics. Management of the asthma. They have to, A means adrenergic beta-2 antagonist, S means steroids, T means theophylline, H means hydration, M means mask, oxygen mask, then A means anticholinergics. Drug therapy. Long-term control medicines to achieve and maintain control of persistent asthma. First, anti-inflammatory drugs, corticosteroids, bronchodilators, long-acting beta-2 adrenergic agonist, theophylline. Then quick relief medicines to treat the symptoms of exacerbations. Then bronchodilators, short-acting inhaled beta-2 adrenergic agonist, anticholinergics, corticosteroids. Quick relief medicines to treat the symptom of exacerbation, bronchodilator, short-acting inhaled beta-2 adrenergic agonist, then anticholinergics. Patient teaching related to drug therapy should include the name, dosage, method of administration and schedule. Take into the consideration mealtime activities of daily living. Include purpose, side effect, appropriate action if side effects occur, consequence of improper use, and the importance of refilling the prescription before the medicines run out. Non-prescription combination drugs. Several non-prescription combination drugs are available with disease. They are usually combination of the bronchodilator and expectorants. Example, epinephrine. Disturb the sleep pattern related to anxiety, dyspnea, as evidenced by awakening, prolonged onset of sleep, lethargy, fatigue, and irritability. Risk for the this is the formulate the nursing diagnosis. Risk for the infection related to decreased pulmonary functions, possible corticosteroids therapy, and lack of knowledge regarding the signs and symptoms of infections and preventive measures. Then conclusion, eating fish oil rich in omega 3 fatty acids could help reduce the risk by nearly 70%. Fish oils is dubbed as one of the healthiest food you can add to your diet. It is enriched for the polyunsaturated fatty acids or N3 and contains omega fatty acids 3 and 6, which is known as to play a crucial role in brain development and facilitate functions of the central nervous system. Thank you.